Ginger, nature's miracle root that boosts your immunity, fights nausea, and even aids digestion. But what if I told you that this miracle could actually be dangerous for some people? Yes, the same ginger you add to your tea or smoothies might backfire under certain conditions, and ignoring this could have serious consequences. Today, we are uncovering hidden dangers of ginger that no one tells you about. Ginger has been celebrated for thousands of years for its medical properties, from reducing inflammation to calming an upset stomach. It seems almost too good to be true. But as with many natural remedies, the benefits come with a few hidden risks. While ginger is safe for most people in moderation, there are specific conditions, medications, and situations where it's better to avoid it. Understanding these scenarios can help you stay safe while still enjoying ginger's powerful benefits. In this video, we'll explore science-backed reasons why ginger may not always be safe, who should be cautious, and practical tips on how to use it wisely. 1. People with bleeding disorders. Ginger is widely known for supporting heart health, but one of the reasons it helps the heart is also the reason it can be dangerous for certain people. Ginger has natural blood thinning effects, meaning it can slow down the body's ability to form blood clots. For someone with bleeding disorders such as hemophilia, low platelet count, or frequent unexplained bruising, this can be a serious problem. When blood does not clot properly, even small cuts, injuries, or internal bleeding can become harder to control. Research shows that active compounds in ginger, especially gingerol and sugarol, inhibit platelet aggregation. Platelets are the cells responsible for forming clots and stopping bleeding. When ginger interferes with this process, the blood becomes thinner, increasing the risk of excessive bleeding after injuries, heavy menstrual bleeding, and prolonged bleeding during or after surgery. This effect becomes much stronger when ginger is taken in high doses, especially as supplements, powders, or concentrated ginger shots. Now, the recommendation here is if you have a bleeding disorder or a history of excessive bleeding, avoid ginger supplements and medicinal doses. Be cautious even with daily ginger tea or large quantities of raw ginger. Stop ginger intake 1 to 2 weeks before surgery unless your doctor says otherwise. 2. People with certain conditions taking certain medications. Ginger can influence the cardiovascular system in powerful ways. While this can be beneficial for some, it can be risky for people who already have heart conditions and are taking prescription medications. This matters because ginger can interact with blood thinners like warfarin or aspirin, blood pressure medications, and diabetes medications often used by heart patients. Ginger can enhance the effects of these drugs. That means it may push the blood too far in one direction. For example, blood pressure may drop too low, causing dizziness, weakness, or fainting. Blood may become too thin, increasing bleeding risks. Heart rhythm may become unstable in sensitive individuals. The hidden risk. Many people assume that because ginger is natural, it's always safe. But when combined with heart medications, it can behave like a drug amplifier, making medication stronger than intended. So if you have heart disease, high blood pressure, or are on long-term heart medications, avoid high-dose ginger supplements. Do not mix ginger shots with medications without guidance, and always consult your doctor before using ginger for medical purposes. Small amounts used daily in cooking are usually safer than daily therapeutic. 3. People with gallstones. Ginger is known to support digestion, but this benefit comes with a hidden downside for people with gallbladder problems. How ginger affects the gallbladder. Ginger stimulates the liver to produce more bile, a digestive fluid that helps break down fats. Now, in a healthy gallbladder, this is helpful, but for someone with gallstones, increased bile flow can create problems. When bile production increases, the gallbladder contracts more forcefully. Gallstones can move or block bile ducts. This may trigger sudden gallbladder pain, nausea, vomiting, or inflammation. So if you have gallstone or gallbladder diseases, avoid ginger supplements and concentrated extracts. Be cautious with strong ginger teas or raw ginger. Small amounts in cooked meals may be tolerated, but listen to your body. If ginger causes abdominal pain after eating, it's a clear sign to stop. Ginger is a powerful medicine, not just a spice. What heals one person can harm another if used at the wrong time or in the wrong amount. 4. Pregnant women, especially in high doses. Ginger is widely known as a natural remedy for morning sickness, and many doctors do recommend it, but only in small controlled amounts. Problems can arise when ginger is taken in high doses, especially in supplement form. Research shows that small amounts of ginger, such as fresh ginger in food or mild ginger tea, are generally safe during pregnancy and can help reduce nausea and vomiting. However, large doses of ginger supplements may have unintended effects. Ginger contains active compounds like gingerols and shoguls, which can thin the blood slightly, stimulate uterine activity in very high amounts, increase the risk of bleeding in sensitive individuals. While serious complications are rare, scientists caution that excessive intake may interfere with normal fetal development, especially during the first trimester when the baby's organs are forming. Why supplements are riskier? Ginger capsules, powders, and extracts are highly concentrated, making it easier to consume more ginger than intended, sometimes the equivalent of several cups of ginger tea in one dose. Safe recommendation here is you should stick to 1 to 2 grams of ginger per day from food or tea. Avoid high-dose ginger supplements unless prescribed. Always consult your OB, GYN, or midwife before using ginger medicinally. Ginger can be helpful during pregnancy, but more is not better. 5. People with stomach ulcers or acid reflux, GERD. Ginger is famous for improving digestion, but for people with stomach ulcers or acid reflux, it can sometimes make symptoms worse instead of better. How ginger can cause problems? Ginger works by stimulating stomach acid production, digestive enzymes, and gastric movement. This is great for slow digestion, but if your stomach lining is already damaged or inflamed, extra acid can cause burning chest pain, heartburn, worsened acid reflux, nausea or stomach irritation, and abdominal discomfort. For people with peptic ulcers, ginger's warming and stimulating effects may further irritate the ulcerated tissue, slowing healing. Now, who should be extra careful? People with GERD, those with stomach or duodenal ulcers, anyone who experiences heartburn after spicy or acidic foods. Avoid ginger shots, capsules, or concentrated powders. Use small amounts in cooked meals instead, and stop using ginger if symptoms worsen. Ginger helps digestion, but only when the stomach lining is healthy. 6. People scheduled for surgery. This one is the most important warnings about ginger, and one many people don't know. Why ginger is risky before surgery? Ginger has natural blood thinning properties. It reduces platelet aggregation, which means it can slow blood clotting. During surgery, this can lead to excessive bleeding, difficulty controlling blood loss, delayed wound healing, or increased risk of post-surgical complications. How much is too much? Regular consumption of ginger tea, ginger shots, and ginger supplements can build up its blood thinning effects over time. Medical recommendation. Most doctors advise stopping ginger at least 1 to 2 weeks before surgery, including herbal teas and supplements. Always inform your surgeon and anesthesiologist if you consume ginger regularly. Natural remedies matter just as much as medications. Natural does not always mean risk-free. 7. People with diabetes. When ginger becomes too powerful. Ginger is often praised for its ability to help lower blood sugar levels, and science supports this. Studies show that ginger can improve insulin sensitivity and help cells absorb glucose more efficiently. For some people, this is a huge benefit, but here's where the problem begins. If you already have diabetes and you are taking blood sugar lowering medications such as insulin, metformin, and sulfonylurea, ginger can push blood sugar too low. This condition is called hypoglycemia, and it can be dangerous. Low blood sugar symptoms may include dizziness or lightheadedness, shaking or sweating, rapid heartbeat, confusion or difficulty concentrating, sudden hunger or weakness. In severe cases, hypoglycemia can lead to fainting or seizures. Why this happens? Ginger doesn't replace diabetes medication, but when combined with it, the effects can stack up. Ginger may enhance insulin activity while your medication is already working hard, causing blood sugar levels to drop faster than expected. This risk is much higher with ginger supplements, ginger shots, and large daily doses than with small amounts used in cooking. Monitor your blood sugar closely if you consume ginger regularly. Avoid high-dose ginger supplements unless approved by your doctor. Speak to your healthcare provider before using ginger as a natural treatment for diabetes. Natural dose does not always mean harmless, especially when combined with medication. Ginger is indeed a powerful natural remedy, but it is not risk-free. People with bleeding disorders, heart condition, gallstones, stomach ulcers, pregnancy concerns, diabetes, or upcoming surgeries need to be especially careful careful. In these situations, ginger can shift from being helpful to potentially harmful, especially when taken in large amounts or concentrated forms. For most people, small amounts of ginger in food or tea are generally safe, but ginger supplements, extracts, or daily high doses can pose serious risk for certain individuals. So next time you reach for that ginger shot or load your tea with extra ginger, remember, it's a miracle root with a hidden flip side. Use it wisely, respect its power, and it can still be a great ally for your health.